is Alexis Mitchell, and we're going to interview Keaton. What's your last name? Kramer, and he works at Sovereign Rehabilitation. And we're just going to ask him a couple of questions about the knee. So the first question we're going to ask him is, what are the most common knee sports injuries?
Most common knee sports injuries, as far as traumatic stuff, would be ACL injuries and torn meniscus, things like that. And then more like overused running injuries would be patellofemoral pain syndrome, and then kind of like just mild fascial pain from overloading muscles and stuff like that.
Okay, so what are the meniscal and the ACL injuries? What are they caused by?
Both of them are caused a lot by the same kind of things. If you have poor hip mechanics, it changes the mechanics at your knees. So if you land and don't have good hip control, your knee will fall in kind of like this, and so it's basically kind of going in this valgus motion where you get kind of a buckling here. Not only is it buckling kind of this way, but it's also twisting, and so both of those things restrict that twisting motion, but there's a certain point when it tries to restrict it and then the tissues kind of give way.
Yeah. Okay. So, what can people do to keep from preventing from those injuries?
So, in PT and a lot of sports prevention and stuff like that, a lot of people teach hip strengthening and kind of proper posture when you're landing. So, when you land, instead of landing and letting your knees cave in, land with your knees straight like that.
Okay.
Especially when you're doing a lot of jumping and things like that. So we teach athletes, especially like soccer players, who get a lot of ACL injuries when they're jumping, to land like this, and when they explode out of it, not to go like that when they explode, but to go like
So
that.
like keeping the knees apart and not letting them pull in. Okay, and then what is the recovery time for those injuries?
If you get a meniscus repair, then I think that's longer, maybe like anywhere from 6 to 12 months. A meniscectomy, where they just cut out part of it, you return in about 4 to 6 weeks.
Okay.
Whereas ACL, you can return, like high-level athletes, they'll return in as little as 9 months, but I don't really recommend that early of a return, but usually about 12 to 14 months for most ACLs.
Okay. Well, thank you for answering those questions for us.
You're welcome.